and welcome to my YouTube channel. Thank you very much for watching. Now, in today's video, I want to do a small comparison about the Kenyan medical system, like going to the doctors and appointments and all that, compared to here in the Netherlands. So just a disclaimer, I am not a medical practitioner, I am not a health expert, so I'm not going to get into deep into details. I'm just gonna tell you guys like just the general points. And with that said, let's get into the video. So the first point is medical insurance. Verzekering. Medical insurance here in the Netherlands is a must. Like, you pay every month. Every month the money gets deducted from your account, or per year or per quarter, it depends. But in Kenya, I cannot say that it's a must. It is advised, it is encouraged. So the big difference is that here in the Netherlands, everybody is insured medically, but in Kenya, not everybody. The rich, for sure, because they're able to pay for it every month. But the less rich, let's say the poor, because some of them don't have that money at the end of the month to pay for NHIF. Not everybody in Kenya is insured, not like here. Medical insurance in Kenya is not mandatory, while here in the Netherlands, you must get insured. My second point, let's call it the types of hospitals. So in the Netherlands, everybody has a houses. That is the family doctor. When you have some problems, you go to the houses. And you also have, like, let's just say one second house, one main hospital. Every town has a public hospital where everybody goes to. Yes? But in Kenya, I will talk about the two main different types of hospitals, the public and the private hospitals. So private hospitals are like this. The people that go to the private hospitals are people that have money, like the rich. And if you have some money that you can spend on medicine or research or consultation fees, because the consultation fees in private hospitals are much higher compared to the public ones. So then people with some money go to private hospitals. The ones that only have money for food, from your pocket into your mouth, those, they go to public hospitals. And in public hospitals, the system is like first come, first served. So if you're there a little bit late, you will have to wait until like the people that were there earlier before you to get served. And then when it's your turn, you go see the doctor. And private hospitals, you have like women hospitals in a different place. You have like eye clinic, private eye clinic in a different place, gynecologist in a different place, in a different hospital. But in public hospitals, you have all these specialists in the same hospital, but in different wings. So there is a very big difference between private hospitals and public hospitals in Kenya. They all go to, social status. What is your social status? Do you have money? Don't you have money? Then you see which one you can go to. So my other point is, I think is point number 3. While here in the Netherlands, before you go to see your family doctor, you must make an appointment. In Kenya, you don't have to. In Kenya, you can just wake up in the morning. If you feel, tonight I feel like I have a headache, you can just go to the doctor. There is always there is always a doctor on duty. And that is mostly also in public hospitals. And you can just wake up in the morning and say, today I'm not feeling well, I'm going to the doctor. So it just depends on what time are you arriving at this hospital, because there are people also there that want to be served. So it depends. You have to wait until it's your turn to get served, even if it means the whole day. But here in the Netherlands, you must make an appointment before you go to see your houses, and you must be there on time, because if you're not there on time, then the doctor, they call your name, you're not there, then the doctor goes to the next one. I don't know if it's still possible to see a doctor if you are late. Is it possible, guys? Please let me know in the comment section below. But also in private hospitals, you can call in, make an appointment, because then they can tell you what time the doctor is in, so that you don't need to go there and wait for the doctor the whole day. Maybe the doctor, mostly these doctors go to public hospitals, they work there until a certain time. And in between, because these doctors maybe own these private hospitals, they go to their private hospitals at a certain time. That is why in private hospitals it is possible to call and make an appointment compared to public hospital, because I think I mentioned before, public hospital is first come, first served. Number 4. So here in the Netherlands, you cannot just go to the ziekenhuis, that is the big or public hospital. You cannot just go there and go to the reception and say, hey, I want to see the gynecologist, or maybe I want to see the doctor. You cannot do that. First of all, you must go to your houses, that is your family doctor. And then if he is not able to take care of the problem, then he will send you to a specialist, that is the gynecologist or the eye doctor or the skin doctor or something like that. But first of all, here in the Netherlands, if you have a problem, you have to go first to your family doctor. But in Kenya, it is not like that. Maybe for people that go to private hospitals, then they have their own family doctors. But for the public hospitals, for the other people, the rest of the Kenyans, you don't have a private doctor, you don't have a family doctor. You just wake up, you go to the public hospital, you wait until it's your turn to see the doctor and tell him about your skin problem. You also have a choice, because if you have some money that you can spend at a specialist, let's say a skin doctor, you can just go there directly. Maybe you can pay to go directly to the eye doctor. Also, you just go there directly. But in public hospitals, these doctors are wonder doctors. I think they can solve almost every problem. Is it your skin? They can just, unless it is very, very serious, they will write you a letter that you go to a specialist. So I have said that here in the Netherlands, everybody has a family doctor, yes? But what happens if your family doctor has traveled? He's gone, I don't know where, for vacation, to enjoy his life. What happens then? Do you go to just any doctor? No. What happens is that you call that number, your family doctor's number. That is what happens normally. That is what I know. You call that family doctor number, and then they will give you an option. They will not leave you unattended. So there will be something like, op dit moment is de huisarts op vakantie. At this moment, the doctor is on vacation. But you can call this number and they will see you. And it's called the huisartsenpost, and that doctor, the alternative doctor, will take care of you before your doctor comes back to work. So everything is just sorted. Another point that I'm going to talk about is, let's say you broke your leg in the night or during the weekend, because during the weekend your family doctor, mostly family doctors don't work. You have terrible pain, or maybe you have an unstaking, maybe you have an inflammation in your eye. You must at that moment go to the doctor. So what do? You're allowed to go to the first aid, emergency department, where they can help you. And to go there, mostly, let's say your child fell or you broke your leg, then you can maybe just call like the emergency number, because there are also those emergency doctors numbers that you call them and then you tell them, and then you are like, I'm on my way, I'm coming to you. Or you can just go there directly. If you have so much, sometimes you have just so much pain and you just want to go there immediately. In Kenya it's also like that. If you break your leg, or maybe you get into an accident or whatever, you're so sick that you really need to go to the hospital at that moment, it is possible to do that. And that is mostly also in public hospitals. But the bad thing about public hospitals is that if you get there and the doctor is not there, oh my god, then my friend, you will have to wait until the doctor arrives. Now, my next point is about chemists, drugstores, apotheek, where you get medicine. In the Netherlands, you can go to a drugstore, to the apotheek, but you will not get any strong medicines. Like antibiotics, no, not without prescriptions. Strong painkillers, no, not without prescriptions. In the Netherlands, first of all, you go to your doctor and he writes down what you need. He writes down exactly what prescriptions you need, and then normally it is just sent through the system to your chemist. There you go and collect your medicines that has been prescribed by the doctor. In Kenya, you can just go to a drugstore, to the chemist, and you tell them all your problems. You tell them how you feel. Oh, my heart is beating so fast, I have so much pain, I can barely speak. And the person there is going to prescribe you, like he's going to give you medicine, also antibiotics, also really, really strong painkillers. So let me tell you a little story real quick. The last time that we were in Kenya, my husband ate something that didn't sit well with his stomach. So he had food poisoning, yes? So he got diarrhea and he was also throwing up. And days later, his stomach was not okay. He had a really swollen stomach. He was not well. So then I went to the chemist. This is in Mombasa. I went to Mtwapa. I went to the chemist and I told them exactly the conditions that he had, his symptoms. I described to that guy. Immediately that guy behind the counter at the chemist said a name. He told me he needs to take this medicine. I took that medicine, I paid 100 Kenya shillings, that is €1, and then I went back to the hotel. And I don't know, I think it is something that is just Dutch curiosity and wanting to know what is this exactly and that. So my husband, luckily, being Dutch, he went ahead and he checked on the internet. He Googled that type of medicine and what it's about and what does it cure and all that. And do you know what we saw? This is very funny. Oh my God. The medicine was for vaginal infections. So let's just say him being a man and not having any problems with that, he didn't take it. So yeah, we needed to go. We found Eno. Eno helped him a little bit. If you know Eno, is the one that you put in water, especially when you have too much gas or you've eaten something that doesn't sit well. It's called Eno in Kenya. I don't know what is the name here in the Netherlands, but you put it in the water and then you drink it. That helped him. So it was better than the vaginal infections medicine. And I'm not saying that to bash, to say something negative about the chemists in Kenya. No, most of the time they get it right. Most of the time you get the right medicine. Sometimes you just get the wrong medicine, and by the grace of God, you get better. So to finish this video, I would like to say, for me, the Dutch medical system is much better. The system is much better because then it is equal for everybody. Everybody gets treated the same way. You might have a family doctor and your mayor is going also to the same family doctor, you see. The thing that maybe differs is obviously the type of insurance that you have chosen. Some people have problems like health problems and they need to go to specialists, you know, like the dentist or maybe the eye doctor several times in the year, or go get a massage because they have problems with their back or something. So then they choose a different type of insurance, but just the standard insurance, if you, for somebody who doesn't get sickly or whatever, is just okay. So most of the people, you find that most of the people who are just, you know, let's say don't have health problems, don't have too many problems, choose for the standard one, and that covers them throughout the year, and it's okay, and you get the same. My point is, here in the Netherlands, you are treated the same. It is equal. When you go to the hospital, it is equal treatment that you get. But in Kenya, on the other hand, you have the poor and the rich. So the rich, they can choose to go to private hospitals, they can choose to see the doctor whatever time they want, and they can, because they have money to pay, and they can always go to other countries. They can go to Europe, they can go to the UK, to the USA for proper treatment and much improvised treatments, while the people that don't have money, the poor people, remain in Kenya and they must do with the doctor that is available. So that is not fair. That is such a bad thing. The fact that it is like that, it is not fair, but that is how it is, and there's no way to change it. I don't think there is. We can say that maybe it will change, but there's no way to change it. So that is just how it is, and it is very unfortunate that it is like that. But you know what? Faith and the grace of God, for me, that is what I believe in. So I'm gonna end this video here, guys. I hope you have learned a thing or two. If you have points that you would like to share with me and also my subscribers, please go ahead and just write it in the comment section below. That will be really appreciated. If you haven't subscribed to my YouTube channel yet, please go ahead and do that also. Just click also on the bell so that whenever I post a video, you will be immediately alerted. Thank you very much for watching this video. Thank you to all my 1,000 subscribers, because I know when I'm posting this video we are already on 1,000 subscribers. You guys are amazing. You guys, I cannot thank you enough. Thank you very much, and I will see you guys in the next video. Bye bye. Don't forget to like, share and comment. Bye.